Delighted to welcome my next guest to the show now. Start this hour off, Environment Secretary George Eustice. Good morning to you.
Good morning.
Good morning. Well, look, let's start with actually your area of responsibility. And this is this 7-year plan to transform our local environment, our farming industry, with a big change to those post-EU cap payments, which used to be basically the bigger the farm you've got, the more subsidies you get from the EU, paid for by British taxpayers. You're going to be changing that. What's going to be the big change?
Well, we've had under our EU membership the Common Agricultural Policy, which never had a great reputation. It was hopelessly bureaucratic with huge numbers of rules that farmers struggled to comply with, vast amounts of paperwork. But most importantly, it rewarded farmers based on how much land they owned or rented. And it meant that the largest and wealthiest landowners got the biggest payments, which really makes no sense at all. So what we are replacing that with, and we recognize the dependency that some farmers have on the subsidy payments, so we'll do this over 7 years, but we're going to replace it with new payments to support farmers and reward them for making space for nature, for farming more sustainably, to improve, for instance, water quality and to help soil health and prevent soil erosion, and also for enhancing animal welfare as well and adopting practices of livestock husbandry that are good for animal welfare. So much more around directing the money to deliver results and outcomes rather than arbitrarily doling it out based on how much land a farmer has.
Okay, I think a lot of people will be very happy about that. Though, of course, there will be losers as well as winners, as we always are in these cases. I know that an awful lot of people listening right now that want me to focus on the restrictions that are affecting far many more millions of us right now. We've had some offers from the Prime Minister ahead of this vote in the Commons on Tuesday about the tier restrictions as we leave this second lockdown. And there is expected to be a revolt of up to possibly 100 Tory MPs either voting against or abstaining, meaning that the Tory party will have to rely on Labour votes to get it through. This promise of a sunset clause on February the 3rd, just 9 weeks, we're told. There's a promise of this cost-benefit analysis later today. Do you think that's going to be enough to win enough rebels over?
Well, I hope so. And I think the reality here is that there's clearly a lot of frustration with the emergency measures that we've had to take to deal with this pandemic. They are extraordinary measures. We completely understand that. We haven't taken them lightly. We don't want them to stay a moment longer than is necessary. But we do judge, the lockdown to have been necessary to get the virus back under control, and some ongoing restrictions through this tiered approach to be necessary, for the rest of the winter. But the Prime Minister's clearly he wants to involve Parliament in this process. So there will be a review at the end of January where Parliament can express a view on what happens after February when they expire.
They can express a view.
Things regularly.
They can express a view. Is that all they get to do? Express a view?
Well, Parliament, if it expresses a view on a particular type of motion, then obviously it can stop things happening. That's always been the case.
You said that we've had to take these measures, but you said the knockdown was necessary. The data from the Tim Spector's King's College Zoe app and the ONS data has backed this up, and GP surveillance records have backed up the fact that we passed the peak of infections before lockdown, that we know infections were falling in nearly all regions before the lockdown. Hospital admissions peaked on November the 5th. Why did we have to have a lockdown?
Well, because the prevalence was quite high in some areas.
Was quite high.
Well,
some areas. So the tiered restrictions would have been enough then?
Well, what we discovered with the tiered restrictions is that tier 1 generally wasn't enough to keep the virus in check. So it didn't get that R value, as they call it, below 1. We still had significant growth in the virus. Tier 3 was managing to hold it into check. But we faced a situation where there was quite a growth, a rapid acceleration in the incidence of the virus in many parts of the country, including areas like my part of the world in Cornwall, where the incidence was low. And we judged that it was necessary to take that overall approach and have a lockdown.
So was there significant growth, or were infections falling? I mean, it's the official data shows that infections were falling.
Well, my understanding is that at the point when we took this decision to go into the lockdown, we were still seeing, for instance, in the southwest, a doubling of the infection rate, albeit from a low base, but a doubling of the infection rate roughly every 10 to 14 days. So it was still accelerating in those parts of the country that weren't in the tier 3 lockdown. And that is why we judged it necessary to take the measures we did.
Okay.
And of course, there is some data out today that shows a significant reduction in incidence since the lockdown of about 30%. So it seems to have delivered what we wanted it to.
Well, the REACT study has shown 30% before, but given that infections were falling in nearly all regions before then, including in places like Liverpool that were hotspots, I don't think we can necessarily say it was the lockdown that delivered that, can we? Well, I mean, if they were going up until the moment of the lockdown and then the lockdown brought them down, then you could perhaps make some causality, as opposed to the infections had peaked already, they were going down anyway, and then you had a lockdown, and now you're claiming that the lockdown resulted in the infections going down. I mean, correlation isn't causation, you know that.
Well, I do know that, but my understanding is that the data for this latest survey what has been done over the last couple of weeks. So it has been taking place during lockdown. And what we were finding with the tiered approach before is that people were just moving from tier 1 to tier 2 and tier 3 and so on. And
they weren't moving. The government moved them. It doesn't. Yes. It's a political decision to move them.
It was, and we were having to take those difficult decisions to move people because the approach was sadly, and we tried it very, very hard. Matt Hancock was a huge advocate of the regional approach, the tiered approach. We stuck with that as long as we could, but we decided you stuck with it. You
stuck with it for 2 or 3 weeks.
Well, we'd actually been running a regional approach since the summer. There were, of course, a number of
the tiers were in place for 2 or 3 weeks.
Yes, but
so that's not as long as you could. Given that you don't really see an effect in infections for 2 weeks, we're told, and you don't see an effect in hospital admissions and deaths for 3 weeks and then 4 weeks. Why is that as long as you could?
Well, because the evidence that we had at the time was that we were seeing the virus really starting to accelerate again right across the country in areas where you had high prevalence as well as low prevalence. And that's why we judged that a lockdown to break the spread of the virus was necessary.
What's going to happen, do we think, on February the 3rd then? Because in last March, we were told 3 weeks to flatten the curve. Then we were told it'd be back to normal by Christmas. Then we were told repeatedly no second lockdown. Then we were told freedom by spring. Now there's talk of summer. Dominic Raab, your colleague, the Foreign Secretary, yesterday was talking about a possible third wave. At what point does this stop? At what point do we actually just say this is an endemic virus, we're never going to have zero COVID deaths, and that we are going to have to allow people who are not vulnerable or very elderly to get back to their normal lives, save the economy, and stop causing more deaths from lockdowns in the long term than we are saving from COVID? At what point is enough enough?
Well, I think really it's important for us to show a way through this, and the solution ultimately is a vaccine. Now, we've got a number of very encouraging vaccines that are ready probably for deployment quite soon, one potentially before Christmas, but others as well that we believe can be deployed from the new year. And we will be getting those vaccines out.
From the new year? I mean, a few weeks ago, it was all going to be deployed by Christmas.
We never said that. We always said there was a possibility that the Pfizer one could start to be deployed by Christmas.
So you did say that.
It's always been the case, though, that the new year is when you would start to roll these out and roll it out as quickly as you can to those vulnerable groups. I think you then get to the point in spring and early summer where you've got the weather changing and the weather changes and you're able to get improved weather conditions that start to burn the virus off. But B, the impact of that vaccine starts to take effect.
Okay, but again, there's a big concern about how long this will take because we've been told that we could get everybody vaccinated by Easter, and then we're told that we could possibly get the vulnerable vaccinated January, February, and then it's the vulnerable. Boris Johnson last week was saying about majority of the vulnerable who want the vaccine by Easter. I mean, we are talking about very, very movable dates. Do we actually have any fixed dates on once the vaccine is available, how quickly we can roll this out?
Well, we will be rolling out as quickly as possible.
Well, that's not an answer.
Well, we don't have that data yet, but I know that
we don't have that data yet. Sorry, we've spent the last year basically planning for 6 months or whatever, knowing there's going to be a vaccine. Hopefully, surely the government has prepared how they will roll this vaccine out.
Well, they are preparing for that, of course.
No, they should have prepared already.
For that some time.
So they don't know, but they still don't know. So we might have a vaccine approved within a matter of days, but they don't know how they're going to roll it out and how long it will take to roll out. Really?
Well, the Department for Health and Department for Business, who've been working together on this vaccine and its deployment.
They just haven't told you?
They have been working on this and working operationally on how to get it out. For instance, there's been discussion about some of the challenges of getting sufficient refrigeration capacity, because you need to hold some of these vaccines at very low temperatures, and a lot of work on the logistics of getting that out and maintaining the temperatures required has been done.
All right, just final question. Can you explain to me, I mean, I'm not an epidemiologist. I'm obviously not an expert in this field at all, but can you explain to me how having a drink in a pub without a substantial meal puts me at massive, massive risk of catching the virus or spreading to other people, but if I've got fish and chips in front of me, then it doesn't? And why going to a shop to buy clothes on Wednesday will probably kill me or kill other people, but going to the shops on Thursday, if they're open 24/7, is completely safe. Can you explain the epidemiology behind that? Because I'm sorry, I'm not an expert, and I think a lot of my listeners aren't. Can you help explain why that is the case?
Yes, well, the measures we're taking are all about trying to break the cycle of infection. And that doesn't mean that every rule that we introduce and every requirement we put on people is perfectly consistent or might even be considered perfectly fair. Indeed, they won't be. But what we're trying to do overall is to break the number of infections that take place. That means dampening the number of interactions that happen. And in the case of restaurants versus pubs, the evidence is that when people are sat at a table and eating a meal, they're more likely to stay for a period of time, not move around as much, and then depart.
If you've got table service in a pub, you're not allowed to move. I don't know which pubs you've been into where you've been allowed to walk up to the bar. Am I just right that you, as a cabinet minister, have just said to me that you confirmed that, yes, the rules are not consistent and not fair?
The rules are intended to basically reduce the.
But they're not consistent and not fair.
These are draconian emergency measures, and so there's always going to be things you can point to that say, well, that's not entirely consistent. What we're trying to do with these measures is to reduce the weight of infection, to lower the rate of spread. That's been the case.
I know. I'm asking you how that does that. How does me having to order a substantial meal if I'm in tier 2 to go to a pub? How does that lower my chance of catching the virus or spreading it? And how is it okay for me to go to a shop on Thursday or Wednesday but not on Tuesday? I mean, how on earth can those measures be considered to be sensible? I mean, if it's too dangerous for me to go to a shop today, why is it okay for me to go to a shop on Wednesday?
Well, because we're trying to strike a balance. So throughout all of this, you've been able to go to the supermarket and do your food shopping, because obviously we need people to be able to buy food. We've taken the measures we have to dampen the spread of the virus, and it's succeeded in doing that. But we now want to be able to loosen those restrictions so that people can start to shop again.
And somehow we're not all going to die as a result of shops reopening, selling clothes, for instance.
No, but as I said, on all of these things, these are emergency measures that we're taking to try to dampen the virus.
Okay.
And so we're changing the restrictions because we will have got the virus back down to an acceptable level and switching back to a tiered approach. In the case of pubs, the evidence has been that some of the challenges that we had with pubs were where you had large groups of people congregating and actually not maintaining social distance because they were just drinking. They were more likely to maintain social distancing sat down and having a meal. It's simply that. It means that collectively across the whole of society, taking these approaches tends to reduce the spread.
I know you've got to go. I really appreciate your honesty, George Eustice.